How the local 1014 health plan works. Understanding your local 1014 health plan. Each calendar year, you must meet the annual deductible before the local 1014 health plan will begin to pay most covered expenses. There are two types of deductibles. One, individual deductible, $200 per person applied separately to each covered person. Two, family deductible, $600 per family, when the combined individual deductible of 3 or more family members equals the family deductible amount, the family deductible is met. Note, prescription drug, dental, and vision expenses do not apply to the annual deductible. Once you meet the deductible, you share cost with the local 1014 health plan. This is called coinsurance. When you go to an in-network provider, the local 1014 health plan will pay 90% of most allowable expenses and you will pay the balance. When you go to an out-of-network provider, the local 1014 health plan will pay 70% of reasonable and customary charges and you pay the balance. For certain covered expenses, you pay a predetermined fee called a copayment or copay. STO protect you from mounting medical bills resulting from serious illness of injury. The local 1014 health plan limits the amount of coinsurance you must pay each year after you meet the annual deductible. If you use in-network providers, your annual out-of-pocket limit is 10% of allowable expenses, up to $1,000 for individual or family coverage. If you use out-of-network providers, your annual out-of-pocket limit is 30% of allowable expenses, up to $1,500 for individual or family coverage, plus any amounts above reasonable and customary charges. Once you have reached the annual out-of-pocket limit after meeting your deductible, the local 1014 health plan will pay 100% of allowable expenses up to the specific plan limits for the remainder of that calendar year. Annual deductibles, prescription drug or other copayments, non-covered expenses in amounts that exceed reasonable and customary charges do not count toward your out-of-pocket limit.